watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome to a special edition of Inspiring Leaders. I'm Donna Newman, your host for our show, and thank you for watching our program. On this show, we typically meet nonprofit leaders. We talk about the great work they do and the volunteers who support them. But these aren't exactly typical times for any of us, and so you'll notice that we made some adjustments for subject matter and accommodations for the logistics of social distancing. Now, our topic today is COVID-19, and we'll hear from prominent leaders who are continuing to have up-close experience with the coronavirus. In this first segment of our show, we're privileged to have the Emergency Department Medical Director of Methodist Bonheur Germantown Hospital, Dr. Ben Bowman. And in our second segment, we're honored to be joined by the President of Methodist Bonheur Germantown Hospital, Rebecca Cullison. Now, for our first segment, joining us now, Dr. Ben Bowman, the Emergency Department Medical Director of Methodist Bonheur Germantown Hospital. That's really long, isn't it, Dr. Bowman? But the medical director, it's very good to have you on our show, and thank you for being here with us. Now, I guess my first question for you has to do with your background. Can you tell us about your professional background and how long you've been with Methodist Bonheur Germantown? Or Methodist Bonheur?
Right. No. First of all, it's great to be here. Thank you for having me. I came to Memphis in 2003 and started my medical training at the University of Tennessee Health Science Center and stayed here in Memphis for my residency training from 2007 to 2011, and then joined the team at Methodist Bonheur Germantown in 2011 and have been working in the emergency department there since that time. I've been in the medical director role since 2016, I believe.
So, okay, tell me what exactly a medical director does. What is different about what you do from other emergency department docs?
Sure. Well, in some ways, it's exactly the same. So I still work clinically full-time, working shifts in the emergency department every month. But I also serve as liaison between the ED physician group and the hospital administration. I work closely with some of the nursing leaders as well to help identify ways to improve efficiency, processes, and protocols within the department. So I take a little bit more of an administrative role in that aspect, in addition to the clinical responsibilities.
So you see patients, but you have a much broader role as well then, right? So
Correct.
How has your role changed during this pandemic, or has it changed?
Well, in terms of the responsibilities, haven't changed significantly. The types of things I've been focused on and that we've been working on, not only in the emergency department, but across the hospital and the entire healthcare system have changed. Obviously, we've had to make a lot of adjustments to the way that we see patients and care for patients, the way that our emergency department is designed, as well as the hospital as a whole has changed. And so it was very fast and furious early last spring. A lot of new procedures and again, processes that we had to put into place just to try to ensure safety for not only our patients, but also for our associates and providers. So that was certainly a change and a challenge, but I think we handled it well.
I think you have. You've had a number of my friends there, and they all speak very, very highly of the hospital. And I know that they're all coming directly through your department. Do most of the COVID patients come through the emergency department before they go to a room?
Yes, I'd say that by far and away is the most common, if not the only way these days. Generally, when patients begin to feel ill, particularly short of breath, seems to be a very common symptom that we see. They will often seek medical care, and the fastest and easiest way to do that is in the emergency department. And so then we have a chance to evaluate those patients, run tests, obtain blood lab tests, monitor vital signs, and after a time in the emergency department, then make a decision if they need to be admitted to the hospital or if they're safe and stable enough to go home.
Okay. I guess my question is, I spoke to my own doctor about this and asked him, how do you know when you have the coronavirus? And I said, do you have, some people talk about a lack of taste, and some people talk about, all kinds, do you have a fever necessarily? And his answer to most everything I asked was, maybe. Apparently, apparently the symptoms are not completely consistent, or are they? Tell us about the symptoms.
Sure. No, I think that's true. I think inconsistent would be a very fair word. There's certainly some things that are unique to COVID, and I would include lack of taste and smell. That's probably the one that's the most unique. Fever, unfortunately, isn't very reliable. I believe there's been studies that have shown that, up to 50% of people who have been diagnosed with COVID never really run a fever. And so you can't rely on that alone as a telltale symptom. But COVID, like many other respiratory viruses that we encounter, the degree of the symptoms and the type of symptoms can range and affect everybody to some degree a little bit differently. But certainly nasal congestion, sore throat, body aches, chills. A lot of patients end up having some diarrhea associated with the illness. And again, the lack of taste and smell seems to be relatively common, but unfortunately doesn't always present until several days into the illness. So I've encouraged everybody, even if you think it's just a sinus infection or your allergies, it's always best to be safe and get tested so that we can help identify patients early and help slow and stop the spread of the virus.
Yeah, it's a tough one to diagnose. I mean, some people worry about, am I being overly cautious? At what point do you know that it's time to come to the emergency room or to see a doctor or anything like that? Lots of us have, shortness of breath and that kind of thing. So tell me, when do you know to come in?
Sure. Well, again, assuming if you've already been tested and know that you have the virus, I encourage everybody to watch for worsening respiratory symptoms, the breathing trouble. I think it's common for everybody to feel fatigued, feel weak, the body aches, even the fever. And some people, those are things that can be managed, treated at home. But I've told many patients, if you are at the point where you're short of breath, getting up and moving around the house, trying to do just your normal daily activities, if that's making you feel out of breath, that's when it's time to come in and be evaluated. Okay. So that we can make the decision if you need to be in the hospital. Most people will feel a little bit, maybe a little bit more short of breath than normal, sort of like you have a chest cold. But if you can sit down, take a few deep breaths and feel better, pretty quickly, then I don't know that that's any reason to be alarmed. But if you're having labored breathing, having to breathe faster and harder just to get enough air, then that's when you need to be evaluated.
Let's talk about this vaccine. I know many of us are very, very eager for this vaccine. I guess my question is the hospital going to be involved in distributing it, or are you just distributing to your own personnel?
Sure. At this point, most of what we have distributed has been to our own personnel. I know that the Methodist leaders have been working very closely with local health department and following the CDC recommendations and guidelines. So we had a pretty massive undertaking just to get the vaccine out to the providers and associates at Methodist to try to help protect the frontline workers. But I do believe that moving forward, as more doses become available, the hospital leadership will be more than happy to partner with the local health department or the state health department in helping to administer doses as needed.
I guess when I think about the vaccine, okay, so I get it today. I'm guessing that tomorrow I don't go outside without my mask on and shake hands with people and head for a concert. So how do
Absolutely.
you know when it has been effective and when we return to any sort of normalcy?
Right. Well, I think that's going to take time to tell. The studies with both the Moderna and Pfizer vaccines were very positive, certainly proved that the vaccine worked, which is obviously very important.
Yes.
And this, to the best that we can tell, is safe, which is equally as important. But with any vaccine, not just with COVID, but with any vaccine you receive, it takes a minimum of 10 to 14 days generally to begin to develop antibodies. And of course, with Pfizer and Moderna vaccines, they were able to prove that a second dose was necessary to get you to that 95% effective rate. So I don't think that we can rely on just getting the vaccine alone as, proof that we can return to normalcy, so to speak. In fact, I know the CDC is continuing to recommend the distancing and wearing masks. At this point, it's to be determined. They've been able to determine that the vaccine can help prevent illness in individuals who receive it. We don't know for sure if those same individuals if the vaccine will stop those individuals from being able to spread the illness, if that makes sense. There's still at least a theory that it would be possible for someone who's received the vaccine to spread the virus potentially without actually being ill themselves. Again, it's just a possibility at this point. We don't know how likely that is, but out of just safety, and we're still recommending that people do the necessary things, especially till we start to see those numbers drop further in the community and start limiting the spread.
Yeah. Do you believe we'll achieve this herd immunity that they talk about?
Again, time will tell. I believe we'll get there. I really do. It's going to take a significant number of people in the community to get there. I've heard numbers anywhere from 70 up to 80% of the population before we can expect true herd immunity. Now, that being said, even if 50 or 60% of the people get the vaccine, that'll still go a long way in helping to slow the spread.
Yes.
But in terms of getting to the point where we, control it altogether and stop the spread completely, it's going to take a significant number of people receiving the vaccine and or developing immunity through active infection before we get there.
Thank you. And thank you for being with us today. And more importantly, thank you for being one of our first responders and leading first responders at the Germantown Hospital. Thank you so much for all that you do and for talking with us today. We wish you the best.
Thank you so much. Anytime.
We're going to pause now for a short break. When we return, we'll meet the president of Methodist Bonheur Germantown Hospital, Rebecca Cullison.
GHS-TV started in 1982, and it was just a couple of cameras, a couple of on-air personality, and it's really grown into what you see today. It's a multi-million-dollar studio with top-of-the-line technology.
Being able to operate, all of the machinery in the control room, being able to use all of our software and hardware that we have around the studio is a great skill because this is top-of-the-line equipment.
I feel like this class has brightened my horizon. It's something that I never thought I would be doing, especially as a student.
GHS-TV is probably one of the most hands-on experiences a student will ever get in their lifetime.
Welcome back to Crosstalk. Nothing really has just the vibe that we have here.
Especially after you finish, you get a real rush of, wow, I just did that.
By the time a student graduates from Germantown High School, they will know pretty much every position there is, from producing to directing to on-air work.
You learn time management, you learn organization, you learn how to work with people, how to better communicate with people.
We put a lot on them, and they have to be able to have the responsibility and the knowledge to get everything that we ask them.
I had very little experience, so in the past 3 years, the skills that I've learned have absolutely exponentially grown.
The class has actually helped me figure out that I want to go to college for journalism.
When a student graduates, they are the best possible version of themselves that they can be.
Thanks for tuning in. We'll see you tomorrow.
For more information about the Kappa program, visit ghskappa.com or call 755-7775. You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome back. I'm Donna Newman, and you're watching Inspiring Leaders. Today we're talking with leaders from Methodist, Bonheur, Germantown Hospital about COVID-19. We've just heard from the Emergency Department Medical Director of the hospital, Dr. Ben Bowman. And now for our second segment, we're pleased to be joined by the President of Methodist, Bonheur, Germantown Hospital, Rebecca Cullison. Welcome, Rebecca.
Thank you for having me. I'm glad to be here.
I'm so happy that you're here too. Thank you for making time. That's one busy job you've got there now. Tell me about your background a little bit and how long you've been with Methodist Hospital.
So when I finished graduate school at UAB, I moved to Memphis and I came to work here at Methodist. And I've been here now over 16 years. So I started in our campus downtown, and I've spent the majority of my career here at Methodist Germantown.
That's really amazing. You also took a little break out to run the villages for a while, right?
I did. So for 4 years, I was at the village at Germantown, which is a continuing care retirement community that's affiliated with Methodist, and then from there, I came back to the hospital as the president.
Okay, I've got to say this. I've met a number of hospital presidents and all kinds of leaders of organizations over time. You were like the youngest one ever. I know that they named you recently to the Memphis Business Journal's Top 40 Under 40. Tell me, how did you do this? I know that many of in our audience aspire to be as successful as you have been. Tell me how in the world you manage this.
Well, thank you. I appreciate that. And thank you for thinking that I am young. That makes my day. Really, the education was the first part, but I have been so fortunate to have so many wonderful mentors along the way who have really helped me grow, have given me opportunities, and just have taught me so many things, each one of them something a little different. So, they are who I credit my success to, and for seeing something in me and giving me the chance.
That's it. I've known you for a while. Let me just be blunt about that. And you're always very humble about it. But I've got to ask you, in this case, Methodist doesn't have a formal mentoring program, do they? These mentors have just found you and you found them.
Right. Yeah, there's nothing really formal. Of course, we all work together, but yes, I've just been very fortunate with a lot of my leaders along the way have all taught me something different. Many of them have been through Methodist, and some of them have retired now and moved on to other things, but they really have been helpful to me.
So you were named president, and like the next day, the pandemic appears, right?
It was about a year. So I came back and was here in this role for a year or so, and then right after that, yes, is when the pandemic hit and changed a lot of what we do every day.
I bet it has. Tell me about your area of responsibility. You have that entire Methodist campus, correct?
Correct, yes, and all of our off-site locations here in Germantown, those are all part of my responsibility, yes.
Okay, and when you talk about off-site locations, what are you talking about?
So any of our diagnostic centers or breast center, the cardiovascular diagnostic center, all of those report to me as well.
Okay, gotcha. So that's a big area of responsibility. Since you did have a year in the role to begin with, how did your role change when the pandemic hit?
Well, with the pandemic, what we do is always complicated and difficult. The pandemic just added another layer of complexity to what was already very complex, and it's something that we had never faced before. We've never lived through a global pandemic, and so we had to quickly come up with strategies to be able to continue what we do here and do so in a safe way, so patients could still feel comfortable coming and our team could feel comfortable doing what they needed to do as well.
On the website, you make a quote and you say, the heart of our vision is providing compassionate care to improve every life we touch. So that's still the same, right?
Right.
All right.
That's always the same. We always have been and always will be committed to providing great patient care. That's why I come to work every day. That's why I do what I do. And so with a pandemic or without a pandemic, we have to figure out how to make that happen. And that's our role here in the community. And that's what we've been committed to do over this past year. And we have done that and we'll continue to do that.
What has changed? Have your patients changed, your staff, visitation? What has changed with the pandemic?
Right. That's a great question. And a lot has changed. A lot is still the same. Always take great care of patients, and that is the bottom line and will never change. But a lot of things have had to change because of the pandemic. For the patients, what I see and hear from patients, it's a lot of the fear of the unknown. For a while they were, I think, afraid to come to the hospital. I think people are feeling a little more comfortable now, and I hope that will continue to improve because, heart attacks and strokes and all those don't stop just because of the pandemic. And it's really important. And I want people to feel comfortable. If you need emergency care, you need to be taken care of. You need to do that. Don't hesitate. But I think for patients, it looks a little different. Sometimes when you come to see us, if you're here for a procedure or whatever it may be, you may have to get a COVID test. That's another thing that you have to do now that you didn't have to do before. We are going to be wearing a lot of personal protective equipment that you didn't see us all wearing before. So face masks, face shields, that looks and feels a little different. For families, one of the hardest things, probably the hardest thing that we dealt with the pandemic was the no visitation policy that we had for so long. And that's against everything that we believe in here at Methodist. We know that families, and we believe in that patient and family-centered care. The families are so important. So to not have them here was very difficult. Of course, now that has changed. We now allow visitation on a limited basis. We limit it to one person per patient. And that, of course, does not include our COVID patients. But that has helped as we've been able to allow more people in the hospital. For our staff, it's been new challenges, new things that they hadn't faced, caring for patients in a very difficult environment. And we are very used to healing patients. We want people to get well and to go home, and some of these patients don't do well. And so that has taken an emotional toll on our staff that is very real and something that I think that we will be dealing with for a very long time.
Yeah, I think you're right about that. I have noticed that there is a lady in Germantown who's bringing up dinners for you all.
Yes.
She's getting support in the community.
Yes.
That must be welcome.
Yes, she has I've talked to Tammy a couple of times, and she's just a really great lady. And it's a really neat story of how that even started. But yes, I noticed she's not doing it for a long time. She did it every night, which was incredible. And then now it's periodic. She's able to get donations and she brings meals up. And it is so appreciated by our staff and just shows what a great community we live in.
Even when I was talking to Dr. Bowman a moment ago, I had to remember that he is also a first responder, as are you. And that's important to us, so we appreciate that. I want to ask you something personal, though, because being so young, I know that you have young children. As you think about your children and the next generation, what do you think this pandemic has done to them?
Yeah, that's a great question, Donna. And, first of all, I would say I am so thankful that this virus has not affected children like it has adults. Bonheur is part of our Methodist family, and they have been watching this very closely, and it just hasn't. For whatever reason, it has not affected children, and I'm very grateful for that. But, I think our kids are resilient. They are, I think, many times they're able to deal with this better than we are. I know my kids are wearing masks at school, and they don't complain about it. It just is what they need to do, and they do it and don't really ask questions. But, what my hope is that as we move through this pandemic, that we'll begin to cautiously and carefully and safely return to normal and return to some of those normal things that they're not able to do now. And I hope that we will get there, but we just need to be cautious and safe as we move in that direction.
What's your best advice in a nutshell for the community?
For the community, I have said this all along. Anytime that I could speak to the community, is what I ask is that we take this seriously. Believe me, it is real. And when it is time for your vaccine, when it's your time and you have that opportunity, I would encourage people to get the vaccine. The risks of COVID are much greater than that of the vaccine. I'm sure Dr. Bowman probably spoke to that. But until that time happens, and until we get to a place where we don't have to wear masks, wear your mask, wash your hands, make smart decisions about gathering together with large groups of people. Just do the right things. That's how we're going to get through this as a community.
Well, thank you. And, once more, thank you for all that you do, Rebecca, within our community, and certainly for Methodist Le Bonheur Germantown. It's been a very large pleasure having you and Dr. Bowman here today. And so we appreciate your time, and we appreciate the good work you're doing within our community. Thank you, Rebecca.
Thank you for having me.
And now thank you for being with us today for Inspiring Leaders. We appreciate our guests on today's show, Dr. Ben Bowman and Rebecca Cullison, both with Methodist Le Bonheur Germantown Hospital. I hope you've learned more about COVID-19 and particularly how to avoid it for you and your family, and also how to help prevent it from spreading even further through the rest of our county, our country, and the world. I also hope you feel even more reassured and perhaps a little bit inspired by our leaders who are working so diligently to guide us through this pandemic. Thank you once more for watching our show. If you're interested in the air dates of Inspiring Leaders or for our station's complete programming guide, you can visit GHS-TV.org, where we're streaming live 24 hours a day. You can keep up with GHS-TV by visiting our website. We hope you'll like us on Facebook and follow us on Twitter. Thank you for joining us for today's show, and be sure and watch our show, Inspiring Leaders, again next month.